Hello and welcome. If you're an intended parent on a surrogacy journey, you know that planning is a huge part of the excitement. Today, we're going to tackle a topic that's all about preparation and giving you some real peace of mind. We are demystifying the NICU system.
You know, this quote, it's pretty much the perfect mindset for any surrogacy journey. Of course, we're all hoping for a simple, healthy delivery. But being prepared, well, that's not about worrying. It's about being empowered. And trust me, understanding the medical landscape is one of the most powerful tools you can possibly have.
Look, every single parent dreams of that magical moment, holding their healthy, full-term baby right after delivery. But with surrogacy, the journey often involves factors like IVF and a higher chance of twins, which just means being prepared for different scenarios is, just plain smart. It makes sure that no matter what happens, your baby is in the best possible hands from the very first second. So to help with all that planning, thankfully, there's a system in place. The American Academy of Pediatrics has created a really clear classification for newborn care. I want you to think of it less as something to worry about and more as a guide to the incredible, specialized system of care that's available for your baby should they ever need it.
All right, let's dive in and break down what these 4 levels actually mean in the real world. We're going to go from the most common setting for healthy newborns all the way up to the most advanced surgical care. Understanding these differences is absolutely crucial for your birth plan.
Think of this table as your ultimate cheat sheet for the whole system. Right at a glance, you can see who each level is for and what they're capable of doing. So let's use this as our roadmap as we dig into each level one by one. So level 1. This is basically the standard well baby nursery you'd find in most hospitals. It's designed for healthy babies born full term. Now, if a baby does happen to arrive a bit early or needs more support, the team here is absolutely expert at getting them stable before arranging a transfer to a higher level facility. Moving on up to level 2, we have the special care nursery. You'll often hear these called feeder and grower units, which is a great description. It's a really common stop for late preterm twins who are otherwise healthy but just need a little extra time and help to master feeding and get a bit stronger before they can head home. Okay, now we get to level 3, which is what most of us picture when we hear the term NICU. This is really the gold standard for high-risk care. It's equipped to handle very premature babies or newborns with a critical illness. They have everything needed for sustained life support and, crucially, have neonatologists and other pediatric specialists on site around the clock. And finally, at the very top, we have level 4. These are highly specialized regional centers usually located within major children's hospitals. They handle the most complex surgical cases, things like congenital heart defects. It's really important to remember that this advanced level of care is rarely needed.
So, what's the real difference between the 2 highest levels? It can get a little confusing, right? Well, here's a super simple way to think about it. A level 3 is like a general ICU for babies, handling most of the issues that come with prematurity. A level 4, on the other hand, is more like a specialized surgical center for babies who need complex operations.
Okay, so we've got the definitions down, but what do you do with all this information? How does it help? Well, this is where we turn that knowledge into action, because understanding these NICU levels directly shapes the crucial decisions you'll make in your surrogacy birth plan.
Choosing a delivery hospital isn't just about what's closest. It's a really strategic choice. It's a conversation between you, your agency, and your surrogate's doctor. The goal is always to find the best equipped hospital. So for twin pregnancies, for instance, a hospital with a level 3 NICU is almost always the preferred choice. That way, mom and babies can stay together under one roof if any extra care is needed.
And why is this planning so vital, especially when you're expecting twins? Well, check out this number. About 60% of twins are born prematurely, so before 37 weeks. Now, many of them only need a short stay in a level 2. But that statistic alone really shows why having a plan that includes easy access to a higher level NICU is so important. Of course, even with the best plans in the world, sometimes things have to change. What happens if your surrogate goes into labor a bit early at a local hospital that just doesn't have the level of care your baby needs? This brings us to medical transfers. It's a topic that can sound scary, but it really shouldn't be. This is honestly one of the biggest what-if questions for intended parents. You might be in one city, your surrogate in another, and suddenly there's talk of your baby needing to go to a third location. It sounds incredibly stressful, I know, but let's talk about how the system is actually designed to handle this exact scenario. Okay, deep breath. The most important thing for you to know is that these transfers are a standard medical procedure. They are safe, they are routine, and they're managed by highly specialized teams. The transport vehicles, whether it's an ambulance or a helicopter, are basically an ICU on wheels, making sure your baby gets continuous, high-level care for the entire trip. So now that we've got a handle on the medical side, let's pivot to the practical steps you can take as parents to get ready. This is all about creating a financial safety net to protect your family and, frankly, your budget. So, what are your action items? It's actually a pretty straightforward 3-step checklist. Way before the birth, pull out your insurance policy. First, confirm that your newborn coverage is active from the very moment of birth. Then, and this is so key, you need to specifically verify that your policy covers both ground and air emergency medical transport. Making that one phone call can save you a world of stress and money down the road. Whew, we have covered a ton of ground, all the way from medical definitions to practical planning. So let's just wrap this up by summarizing the most important things to take away from all this. This is how you get confidence through knowledge. So what are the big takeaways here? First, remember that not all hospitals are created equal. Second, a level 3 NICU is often the goal for higher risk pregnancies, like with twins. Third, if a medical transfer is needed, it's a safe and standard procedure. And finally, the most important point of all, preparation is everything. Understanding this ahead of time is the key to a smooth and confident journey.
So we'll leave you with this to think about. This knowledge isn't just theory, it's a tool. It's something that empowers you to ask the right questions and to be the best advocate for your family. By understanding how the system works, you're no longer just a passenger on this journey. You're a prepared, confident parent ready for anything. Thanks for joining us.